Doctors around the world provide valuable advice for patients experiencing birth trauma to help them navigate this challenging experience effectively. Here are some key recommendations based on the information from the sources provided. Understanding birth trauma. Birth trauma refers to the emotional and psychological injury experienced during or after childbirth. It can be physical, emotional, or psychological, often stemming from a difference between expectations and reality during labor and birth. It is essential to acknowledge that birth trauma is valid and not uncommon, affecting up to 1 in 3 people who give birth. Risk factors and prevention. Various factors contribute to birth trauma, including pain, lack of pain relief, emotional distress, medical interventions, and feeling a loss of control or lack of respect. While birth trauma cannot always be prevented, preparing for childbirth, seeking support, and understanding the birth process can help reduce the risk. Recovery and support. Recovering from birth trauma is a unique journey for each individual. Acknowledging the distressing experience, seeking practical and emotional support from friends and family, discussing the experience with trusted individuals, and considering self-help measures like exercise and mindfulness can aid in recovery. Seeking professional help, such as counseling or therapy, is also recommended for those experiencing persistent distress. Communication and debriefing. Open communication with healthcare providers, including doctors, midwives, or maternal child health nurses, is crucial. Discussing the birth experience, seeking debriefing services, obtaining details of interventions used during birth, and refraining from self-blame are important steps in the recovery process. Self-care and healing. Engaging in self-care practices, prioritizing rest and sleep, participating in physical activities, practicing mindfulness, and nourishing the body with a balanced diet are essential for emotional recovery. Building a supportive network, exploring different therapy options like psychodynamic psychotherapy, cognitive behavioral therapy, and group therapy, and fostering open communication with partners can aid in healing from birth trauma. By following these recommendations and seeking appropriate support and care, patients experiencing birth trauma can navigate their emotional recovery journey effectively and work towards healing and well-being.